We found that they don't always come back to us in a timely fashion. Okay, this is their home and we're caring for them. And they go into hospital as an emergency, and we do find on many occasions they stay in hospital for a long time, and it's very difficult to get information about how they're progressing. We also find we don't always get enough advanced warning when they are coming back. We've had experiences when our residents have arrived on the doorstep, haven't they, Lynda?
Yeah.
Without any notification. And that's been a challenge.
Distressing for us, of course, the residents and the families, because nobody's had that information.
So the families aren't told either?
No. So, then we're phoning the family saying, Jack's appeared back, and, they can be quite unhappy about that, because they would have liked to have been here, perhaps to have met them, greeted them. And the residents sort of distressed, thinking nobody knows where I am. Nobody's been given the information. I think communication from the hospitals can be quite poor.
And also, the residents' dependency levels may have changed, okay? So if they come back unannounced, it might be that they need additional equipment, all right, or additional staff, which, we don't have a chance to get that in place in a timely fashion, all right, which is not in the best interest of any resident, that's for sure.
I mean, it's often say someone's gone in with a fall.
Yeah.
It might be when they came out, we would get a sort of pressure mat for them to alert us that that person was trying to stand, trying to get up, because we don't want them to come straight back and have a fall again. But it's not something we always have in place initially. And obviously assistive technology is only available free, basically, to the residential residents. So say the person's a nursing resident, then that's up to the home to provide, which is okay, but some homes will not have the money to pay for that equipment. So, our feeling is the assistive technology should be available to everybody, not just residential.
And if it's a need identified in hospital, then again, liaising with the care home to have that piece of equipment couriered in sufficient time to utilise that to safeguard, further falls or alert, or even to use it as a strategy to reduce the risk of falls. That's where we find that communication can sometimes be difficult. But we're also discussing why are residents sent to hospital in the first place. We are a registered nursing home, with 4 units that have qualified, highly qualified skilled nurses. So we've looked at lots of areas where potentially our vulnerable adults could be prevented from going to hospital. For instance, Lynda and I have discussed that why aren't our nurses trained to utilise the gluing method for superficial wounds that don't need to go to hospital. What we need is a greater degree of link nurses, So why isn't somebody investing in training the nurses within the care home environment to make those triage decisions? They can discuss it with the GP over the telephone, all right? We've got all sorts of technology, In Australia, they do lots of their consultation via cameras, So why aren't we utilising the technology we've got nowadays? If we've got consent from relatives, if a person lacks capacity, surely the information sharing would be, why not use the technology we've got in place? Why do we have to call the cam doc out? Why do we have to struggle over the telephone giving vague instructions when actually we've got the ability to actually discuss, actually in real time, the condition of a patient, the look of the wound, so that then it could be agreed that the nurse would then facilitate the gluing of the wound.
Because we have the skills to do the observations, the neuro-obs, things like that. Because it's usually, 9 times out of 10, it's going to be the more severely demented residents that have had the fall, cut the head, and the fact of them having to go off to Addenbrooke's, so distressing for them. Of course, they're even more confused, in that different environment, whereas here they would soon settle. Because they wound glued and we just keep an eye on them, they'd be absolutely fine.
Neurological observations can be fed back, the point is anybody that has any cognitive disability, once you go out of their familiar surroundings with the increase of, stimulus, can actually, mask, behaviour. whereas the staff that are actually looking after them permanently are very well aware of what's normal behaviour. And then even when we do send staff to accompany them, because we wouldn't ordinarily send a resident who's cognitively impaired, who potentially has other disabilities, hearing, visual, okay, in an ambulance, although the ambulance services are wonderful, all right, to A&E, where we all know that the experience, to the best of A&E's ability, means a great deal of waiting time. Now, the figures are, they must be seen within so many hours, but for the person with dementia, that means nothing. Okay, this is a hard trolley, okay, with a lack of ability to get to the toilet, and our care assistants are often in a situation where they haven't got any help, okay, that they're not actually cared for themselves. Half of them come back saying that they might have sat there for 2.5, 3 hours, not had a break, not been relieved, with a person that has many challenges to their behaviour, who's increasingly confused because they're out of their familiar surroundings. When we feel that potentially lots of head injuries with cuts that could be possibly glued could be monitored within the home. And we want to know why somebody doesn't come out and manage it within a home. All right. Getting hold of CamDoc can be a challenge, that's for sure.
Do both of you think, where do both of you think the right environment for older people to be looked after when they're ill is?
Well, we've discussed this many times, Lynda, haven't we? And we feel that our residents should be looked after within our own home environment. We've got skilled, qualified nurses, okay? So I believe that we ought to work together, okay, to keep them within the care home environment as much as possible. It's where they have a sense of well-being, and, we feel that that's where that should be facilitated.